audience. 1, 2, 3, 4, and 5. Well, hello everybody. Today I will be telling you a little bit of depression. Do you know that there is a 6.7% in the United States that suffer from depression, mostly around the ages of 18 or older? And do you know that there is more than one type of depression? Well, in America, there are 6 common types of depression, starting with major depressive disorder, persistent depressive disorder, bipolar disorder, seasonal depression, postpartum depression, and for the last, psychotic depression. But the most common in the United States is major depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression has so many symptoms, like feeling sad, loss of interest, trouble sleeping, loss of energy, and feeling worthless. In fact, as Aaron Berg mentioned in his article, depression is second only to schizophrenia in first and second admission to mental hospital in the United States, and it has been estimated that the prevalence of depression outside of the United States is 5 greater than the of schizophrenia. In this visual, we can see that depression is more common on females than men's, and it's more common in the ages of 18 to 25 and less common on the ages of 50. The causes of depression varies from drugs, generics, stress, and poor nutrition. As you can see on the visual, drugs substance is common among people who are fighting a depressive disorder because of alcohol. It's a central nervous system depressant. The use of these drugs tends to trigger depression, symptoms like lethargy, sadness, and hopelessness. Then generics may be another factor because in most cases has shown that depression, around 50 of the cases, is because of generic. Then stress response fails to shut off and set after a difficult situation has passed, it can lead to depression too. Also, poor nutrition is important because it can lead to depression, as the contributor writer Chris mentioned in his article that a diet in high processed food, sugar, and fat increase the risk of obesity. There's a study published in the Archive of General Psychiatry found that people who were overweight increased their risk for becoming depressed. However, fortunately, it's treatable because there is plenty of cures and treatments for depression. The first is getting adequate sleep. It is really important how the National Sleep Foundation, the Whisper of Sleep, says that sleep is required to feel better, because if they don't sleep, the ability to think, reason, solve problems declines or play, disappear, and will feel like they will not feel better. Also, there is treatments such as therapies, cognitive behavioral therapy, behavior therapy, and psychotherapy. In the cognitive behavioral therapy, this treatment is focused on helping the patient to change the patterns of thinking, like bad thoughts of themselves or their behavior. Then there is behavior therapy. This treatment helps to identify and change potentially self-destructive or unhealthy behavior. And for the last, we will have psychotherapy, that it helps to eliminate and control troubling symptoms so the patient can function better. Well, that's all for today, and I would like to thank you all of you for having me today. Thank you.